I am Aklilu from Love in Action Ethiopia. When the local partners are just transited to the new platforms, just to get funding from the USAID as a prime partners, those international partners previously supporting the local partners or funding the local partners were assigned just to give technical assistances to the local partners. Some kind of rearrangements was made on the roles we play in the new platform. So when USAID was, especially the local missions, I think when USAID was doing this kind of things, we were not given clear scopes and the roles and the mandates of these international partners by that time. They are providing trainings and they are expected to do some kind of data assessments and the data auditing things. And sometimes they are expected to provide a kind of mentoring to the local partners. So still we are doing without having any guideline and without signing any MOUs. Sometimes there are some kind of overlaps and even sometimes it extends to conflicts in some cases because we have our priorities and they have also their own priorities. So that kind of relationship will be good if these TA partners or the international partners have or will be given a clear scope and roles and mandates how they can manage their activities in agreement with what we have in local partners. Thank you. Over to you.
Thank you, Aklilu, for explaining that. So first and foremost, I think you're implementing a program in Ethiopia, and we have a very strong office with many experts, a contracts office in our office in Addis. So I encourage you to reach out to them so that they can walk you through the terms and conditions of the instrument that you are currently using to manage your program. Broadly speaking, it sounds to me like you've gone from what we call a transition type of grant, where you are now the lead. So you are no longer under an international organization. You are now the driver, the sole entity where you own the instrument through which you are implementing the program. So if that is the case, if you have that contract or that cooperative agreement, you are the driver of it, you now need to establish the relationship, a binding relationship with the international organization where you want them to continue providing you the services that you just laid out. Management, financial services, just general management advice. And then you pay them a certain amount of money for those services for a certain amount of time, okay? So I'll stop there, and I do highly encourage you to sit down with your local contracting officer to walk you through the specifics of the award that you're currently implementing. Thank you.
Aklilu, I can just say from my standpoint, from a non-contractual standpoint, where this has been successful is simply the two partners sitting down with their AOR or the joint AORs if it's two projects, and just identifying what are the gaps and needs that the international partner can best align or assist with. It, in many cases, hasn't required an MOU, but really just a joint work plan where there are mutually agreed upon areas that can be strengthened through international assistance. So we've had very strong examples of AORs facilitating that kind of discussion between the local partner and the international partner, and really both see it as that assistance lifting both ships. The international partners are quite invested in setting our local partners up for success, but really it's just been how that is managed by the AOR, obviously in collaboration with our OHA counterparts. And so we'll ensure that that sort of collaboration occurs as I expect it has, but really, again, it has been through just joint work planning between the local and international partner. Over.
Thank you very much, Clint and Luis. And it looks like Simon from Pakacheri in Malawi is also chiming in on some of their best practices for developing terms of reference for TA partners. So thank you very much, Simon, for adding that in as well. We'll go to a question. Does anyone have anything they want to add to that response? Any of our speakers?
So I wouldn't mind adding a few comments related to this. And so thank you, Lindsay, for the prompt. I just want to take a step back and just to thank all of the participants. I think, you know, as OHA is really just done a marvelous job of bringing folks together. And as this is the third annual partners meeting, how important it is from an agency level and from a bureau level, really to see you all taking this leadership role that is so important in your respective organizations. And so Alu's, you know, question is an important one, that he is now really, and his institution, his organizations is actually in the driver's seat. And so really making sure that if you need tools, if you need to have those conversations, you can reach back to the USAID missions in the countries that you're operating. And just to also recognize that so many people from all over the world are watching you, watching what you're doing, wanting to really support you. And so your success is our success, and really just happy to see so many people on this call. So thanks, Lindsay.
Thank you very much, Melissa. So it looks like our chat box is getting up and going. And we have one question coming here from iCARE Uganda. Local partners have a challenge of funding sustainability to meet organizational development needs for HR or organizational development. Are there possibilities for USAID or PEPFAR to prioritize human resource and organizational development for local partners? And we do have our partner here on the line, so if there are questions or we need clarification, we will also welcome that partner to come off of mute as well. Would any of our speakers like to take a stab at answering? Or should we get clarity?
I can step in from a kind of the broader perspective, Lindsay, if that helps.
Sure, please do.
So just generally speaking, regarding, you're asking about prioritizing a certain area, and we're talking about just human resources, investing in people, strengthening the sustainability of your organization. And so it is an allowable cost, right, from the cost principles that regulation legal perspective, under both an assistance instrument or a contract instrument. So it's just a matter of, I think, understanding, is it an allowable cost under the instrument that you now have through which you're operating, implementing your program? And with that, I'll just turn into the philosophies of OHA regarding sustainability to elaborate on that point. Lindsay, thank you.
Thanks, Louise. Just building upon that, a few points. One, as we really intensified this focus on transition to local partners 3 years ago, there was intentional effort made to support the effort from a number of different vantage points. One was to provide additional resources at the mission level so that we could build up capacity across the mission. So not just within the health team, but within our OHA, our financial management offices, and really the talent and expertise that we have within the missions, who many of our staff have supported organizational development for decades in some cases. And there are incredible resources in working directly with organizations and provide technical assistance on various aspects of organizational development. We've also been able to get resources from the Office of the Global AIDS Coordinator to support targeted organizational development support, as Louise has said, this is an allowable cost, obviously, that's authorized through your AOR. But I will say that Anjali Ashwikar in particular has been very supportive of USAID in this regard. You'll see in the COP guidance that will come out in January, further endorsement of investing in local partnerships and supporting you in this work. Obviously, it's a zero-sum game, so we're also providing funding for the service delivery components, but we do take seriously the needs of organizations to be set up for success. We've also been given funding at a central level to support organizational development. So again, as SGAC has been really prioritizing pushing funding out to the field, they have recognized that we need to invest in local partnerships. And that's one area where they've continued to support central funding as well as bilateral funding to support organizational development. So again, I encourage you to work with your AOR about your organizational needs, and they can decide, is this something that we can tap into directly with our mission expertise to support you in that regard, or do we need to bring in additional assistance? Because that is something that PEPFAR and USAID does support. I hope that answers your question.
Great. Thank you very much, Clint and Luis. We are going to move over to our next pre-solicited question, also from Love in Action Ethiopia, around hard currencies. As you know, banks in Ethiopia are suffering from a shortage of hard currencies. In this connection, they have designed policies to especially benefit the staff of local organizations that can receive direct transfer of funds from donors and USAID. In this case, local USAID funded organizations receive and use their funds in local currencies, not in hard currencies. The banks only require direct transfer from back donors, and the local organizations of USAID have nothing to benefit from hard currencies. This is a great and substantial contribution in maintenance and motivation of key project staff, especially for those organizations working in hardest to reach areas and suffering from staff turnover. Are there any opportunities to receive transfers or deposits directly from international offices to USAID funded local organization accounts that are in local currency? So I think we'll pass this over to Walt and Lydia from our CFO office to address this question first. Over to you, Walt.
Okay, so we weren't completely clear on the question, but it sounds to me like what's being asked is whether we can pay in local currency. And the answer, regardless of what kind of organization you are, if you are a not-for-profit, government to government, a research organization, we can pay in local currency. The machinations of how that happens is probably a little bit beyond me in terms of where the exchange takes place. But yes, we can direct money in local currency to your bank account. Pretty much in most of the countries that we work in. I would add that what you want to do is to work with the controller at the mission and the contract officer at the mission to kind of get into this specifically. I have been in places where, like South Sudan, where the banking could be challenging. and to be honest, and when I was in that situation, we actually used Ethiopian banks to solve our problems there. So I would just kind of step back and say, yes, we can pay in local currency and direct deposit that into your bank account.
Thank you very much, Walt. Appreciate that. Do any of our other speakers want to add anything? Otherwise, we can move on to our next question. Okay, great, thank you. Here's another question from the chat box that I believe might have come just to me, so we'll try and put it in for everybody to view it as well. There seems to be a slight difference in the way PEPFAR and USAID define a local partner to be a direct recipient of funding. Can someone please explain the difference? Also, is a separate DUNS number required for either scenario in order to receive funds? So first, a question on the definition of a local partner and whether or not a separate DUNS number is required in order to receive funds for either a PEPFAR local partner or a USAID local partner. Do we have any of our speakers on the line who would be prepared to address that question?
Maybe Lindsay, I can take this first.
Yes, Callie, please go ahead. You might want to introduce yourself because I didn't introduce you, Callie. I'm so sorry.
No problem, no problem. I'm more behind the scenes here. I'm Callie Rolfe-Swang. I'm leading our local partner team in the Office of HIV/AIDS. So the question was about the definition of local partners. USAID has just a slightly different definition than SCAC. Most of the time, I would say 95% of the time, if you those definitions are not in any kind of tension with each other. The definition for a local entity has three components. The local entity needs to be incorporated and registered within the country that it's operating under the laws of that country. It needs to have majority local staff. I think PEPFAR actually requires slightly higher, 75%. And now I'm forgetting the third component, country or region. Typically, if you meet the PEPFAR definition of a local partner, you will also meet the USAID definition. In terms of the DUNS number, this is a kind of a new requirement SCAC is putting forward for us. We, should not be an issue for most local organizations to obtain a DUNS number. I think that's fairly straightforward. We do occasionally encounter challenges when we're working with partner governments or local governments trying to require a DUNS number. We are working with SCAC on a case-by-case basis to address those situations where we can't acquire a DUNS number for our partners. I hope that was a good kickoff to the response, and welcome anyone else in the panel to add. Yeah, I see Louise, go ahead.
Callie, no, thank you. I just wanted to add one thing. I think they were asking if you require a different DUNS number. And so I just want to clarify, it really comes down to how you're incorporated, right? And if you meet the terms that Callie was laying out and how it is that we define a local organization, at the end of the day, if you have a sister partner organization locally, at the end of the day, how are you incorporated where you may want to have your own DUNS number that distinguishes you from a partner or parent local organization? Over.
No, that's exactly right, Louise. That's what the DUNS number helps us really identify. This partner is truly a local partner, right? Not a local affiliate. So that's exactly right.
Wonderful. Thank you so much, Callie and Louise. We will go back over to our next pre-solicited question. Does USAID have special support packages within specific awards for hardest to reach areas, which are often distant from a capital city with poor infrastructure, ecological and environmental challenges, and have problems of staff shortages coupled with high salary expectations, high risk areas in terms of epidemiology, etc. These factors have clear and practical cost implications on project management, and many organizations working in these hard to reach areas have been affected by shortage of funds to safely cover project management and activity costs. So I will turn it over to our speakers, possibly from OHA or General Counsel, to address this question.
Hi, Lindsay. Once again, I'll take a stab at it, and I'll again invite my colleagues to please help in answering this question. I guess stepping back, right, when you, the organization, responded to a solicitation, an RFP or an RFA, that solicitation would have explained the conditions under which you were going to be implementing this program. So what I mean by that is, are there incentives? Are there differentials? Is there hazard pay that the mission is considering given the realities that you're facing in the area where you're implementing your program? This is where I think you're going. Are there differentials, and is there hazard pay because this is what you're facing? I don't have an answer for that because I don't know what it is that the environment in which you're working in and the mission in which you're working in, how they've defined their reality to be. And so I think that it goes back to, is the mission aware of this reality? And then how are they prepared to provide an incentive given the complexities that they're associated with this program? Over.
Yeah, hi, and I would just add on, this is actually in some ways similar to that earlier question about funds for organizational capacity. I mean, it's a very different kind of funding, but it all goes back to the cost principles and what's reasonable for the work being performed. And that's a discussion you have to have with your mission counterparts based on, you know, any kind of particular hazards or dangers faced performing in a certain area. If additional funds are needed for that, then that's a discussion with the mission if it's not already built into your award. Now, it should be built into your award up front if you've submitted your budget proposal and accounted for that. But if it hasn't been accounted for, or if conditions change and there needs to be additional funding, you know, the question implies there could be a trade-off, and that might be the case. If there is no additional funding available from USAID, there could be a trade-off between project management and safety. And of course, USAID is always going to be understanding when it comes to the needs of safety of our partners. But that's again, it's a discussion with the mission based on the specific conditions you're working in and the specific conditions of your award. Thanks.
Great, thank you very much, Luis and Jonathan. So it looks like we still have quite a bit of questions coming through the chat box. Maybe so people don't just hear me asking the questions. I'll ask if people feel comfortable to go off mute and ask the questions themselves. So Trip Allport, you have a question here on the TA marketplace. If you would like to go off of mute and ask your question, you are welcome to. Otherwise, I will read it on your behalf.
Sure. Hi, everyone. Trip Allport from Africa Resource Center. And I recognize this might be procurement sensitive, so you can cut it off. If not, there's a lot of folks asking a lot of questions, getting very excited. It's a fantastic opportunity to extend USAID's localization drive and get more experts on the ground, you know, coming into the TA, you know, pool on the ground for governments and the work we do. I believe we've only seen a paragraph or a couple sentences, so it might be more of a process question. When might more information be released? You know, and when do you believe this marketplace might be stood up so we can start to think about how to engage with that? And for completeness sake, ARC doesn't bid, so we won't be involved, but we certainly would like to benefit and participate from such a marketplace. Over.
Hi Trip, this is James. I can take that one. You were right. That one is procurement sensitive, so this wouldn't be the forum. We share your excitement about everything that's coming out with the next gen supply chain. So also note yours. We'll be sharing that information in a very public forum. I know there's a lot on now, but that additional information will come out kind of through the normal channels. But look forward to everyone being able to see that.
Thanks, James. I thought as much. You don't ask, you don't get. Thanks.
Okay, great. Thank you, James. I believe we have one final pre-solicited question, and then we'll go all to what's in the chat box. This last one we have is on, in the context of Journey to Self-Reliance, how does USAID expand or envision support to local organization sustainability plans or strategies, such as an endowment fund, which is further aimed to improve health and well-being of the society? Is there any information or guidance that can be shared on how a local organization can strengthen its endowment fund? And I did see a similar question coming through on sustainability, so I may try and clump them all together, on local partners needing to sustain their existence for longer time beyond their project lifetime. Is USAID looking at funding strategic plans of NGOs as well for their institutional sustainability? So I realize I combined two questions into one that hopefully were thematically aligned. Would any of our speakers like to take the attempt to answer this? Luis,
Hey,
please.
Lindsay. Yeah, I can chime in a bit, and then again, just reach out to my colleagues to help elaborate and expand. So in general, right, as an agency and now above and beyond the journey to self-reliance, this agency continues to be committed to engaging with and growing our relationships with local partners, right, through localization efforts that we're embarking on currently under administrator power. Sustainability is a heart of that. And so we need you, local partners, to be very clear on how it is that you envision what it is that you need to ensure that your organization is sustainable. And then feel free to reach out to your local AOR, COR, contracting officer, agreement officer to talk through the needs that you have to ensure that you've got the resources to help you address your sustainability needs. On to endowment. Endowments are complicated, so I'm going to try to divide it and clarify it as follows. Again, we're now in the area of cost principles under the CFR regulations. So the only way that you can pursue endowments are basically by arguing that it is consistent with the program and that it benefits your program or our program if it's a contract, right? So you need to prove that to the mission and then eventually start talking about, well, what is it? What are the efforts that you're going to undertake to get resources that will ultimately benefit the program that you're implementing? It's the easiest way that I could answer that. It is under cost principles. If you do not stay within certain parameters, then you'll eventually get into this is the no, this is not possible area. So I'll stop there, Lindsay.
So if I might just add a couple of comments, Lindsay, just from a technical standpoint, how important it is for you all to consider diversifying your portfolios. As leaders in your organizations, the need to really have strong relationships in countries with your government counterparts, with foundations, with other kind of civil society entities are really important. We are all grappling with the ideas of sustainability, not only in the countries in which you work, but also we grapple with that in the US and organizations that are trying to look kind of at the horizon of their own programming. So I will say that, you know, our goal is to really kind of support you in really thinking more broadly about your portfolios and to ensure that you are thinking through not only from a kind of a management structure and infrastructure, but also about the services that you want to deliver. And there's a saying here that we use commonly in the US is like, don't go to one organization and ask for $1 million. Go to 1 million people and ask for $1. That the idea behind a lot of the work that you will do is around really mobilizing communities, really trying to do a good community organizing in your programming. So I'll stop there, but it is something I just wanted to highlight. We're all grappling with it. Totally get your question. And I think there's a lot of best practices that can be shared with, you know, kind of across countries and across organizations. So thanks for that.
Great, thank you very much. I think we're going to move on because we've gotten quite a few questions, and I want to make sure we get to as many as we can. We've gotten a couple of questions on NICRA rates and de minimis, so we'll move over to them. This question, we've received inconsistent receptivity from OHA and African missions when requested to consider a local partner and applying for NICRAs. Given the pivot to local partner implementation, is there a possibility for a local partner to have multiple awards or contracts? Relying on de minimis becomes financially constraining. What is USAID Washington's guidance to local partners who've been denied the opportunity to apply for a NICRA but would like to do so? And then one other question is the 10% de minimis applicable for local partners? So maybe if we can batch our responses on NICRA and de minimis together.
So, Lindsay, if I may, and Jonathan, please chime in on this. Remember that NICRAs and the de minimis are there for a reason, and we're speaking about sustainability. And this is really something that is going to allow you to recover overhead costs that are associated with implementing and managing your program. Okay, very simply put. And so the de minimis, 10% de minimis, right? It's there for a reason, is for those organizations that simply cannot prove that they can actually obtain an NICRA. And it's there for it's there basically recognizing, no questions asked, you will get the de minimis, and so on and so forth. Getting the NICRA, you need to be careful, you know, as a local organization or as a new entity that's really new to the space of development. You need to show records, and here I'm talking about your financials, your accounting records, so that you can show to your controller, to your mission, evidence that will help you get the NICRA, and understand that it may end up being less than the 10% de minimis, or maybe over. The point being is that you need to have that track record that demonstrates that you qualify for an NICRA. I'll stop there unless the organization wants to come in and elaborate more on their question. Jonathan, anything else you want to add on that?
Sorry, hit the wrong button there. Yeah, not much to add. I mean, the one part of the question talked about having multiple awards and requesting a NICRA. So that's normally, I mean, normally USAID does not doesn't generally give a NICRA if you have just one award. It's one of the advantages of the de minimis. It could happen. It really depends on your organization, how sophisticated your organization is, how your record keeping is, and what kind of documentation you can show to the mission. That's really key here. But if an organization is receiving multiple awards, then and you can demonstrate, you can share or spread those costs across multiple awards. You know, that's a case you would have to make with the mission, because the mission is the one normally issuing NICRAs for local organizations. Whether you're getting resistance from missions, that's part of the question was talking about that. That could be a mission specific issue that you have to really talk to your mission controller and your mission contract officer, agreement officer about. It's hard to really answer without the specifics of the case. But broadly speaking, that's a conversation you should be having with your mission based on your own capabilities as an organization and what you can document based on your record keeping. Thanks.
Thank you. I think before we move on from de minimis and NICRA, we have two more questions that just came through. Is a 10% de minimis applicable for local organizations that are subrecipients of USAID funds through international organizations? And is a NICRA applicable to a non-US government organization really? And then we can move on from NICRA and de minimis. So maybe back to you, Luis or Jonathan, or?
The 10% de minimis is applicable to grantees, right? Sub grantees, just the grantee community in general. The question, is it applicable, the NICRA, to non-US entities? Is that the question?
No, to subrecipients of USAID funding through international organizations. International, maybe US-based
Sorry,
organizations.
This question is raised by me. It's Casa. Can I clarify it?
Sure, please do.
Yeah, thank you very much. I raised this issue because 10% de minimis appears in our award agreement. We started to implement the 10% de minimis in FY20, but we stopped in FY22. We removed from our plan. So we are prime partners, and we entered a cooperative agreement with USAID to implement HIV and OVC program. So why is that not applicable for us, the 10% de minimis? That's my question. Thank you.
Thank you, Casa. So I still don't understand why it would not be applicable to you. It should be applicable to you because you are a local organization. You are implementing for USAID, either directly or as a sub. And so per the regulations under the CFR, you qualify for the 10% de minimis.
Thank you.
Sure.
Okay, great. Let's move on to a few questions that came up on COVID-19. Will USAID consider funding amendments to support emerging priorities, particularly for COVID-19, around sustainability of our programming? And then is there a possibility to integrate COVID-19 response activities with current local partner activities? And I believe those were the two COVID related questions that I saw. So considering funding for COVID-19 in existing awards and or future priorities. Maybe somebody from OHA, or I don't know, I think Melissa might have popped off.
I can start. There's been recognition, particularly 18 or so months into the pandemic, that the PEPFAR platform can be strategically leveraged to support the COVID response. And we've seen that to date across the board. Our USAID partners have been critical in providing oxygen solutions in Southern Africa, have been supporting training of staff, to support various COVID-related service delivery activities at the facility level, have supported integration of COVID messaging into communication channels to clients. Some of the adaptations that have come out of the COVID response have included digital engagement with clients, decentralized services, et cetera. So these have been cornerstone interventions in both mitigating the impact of COVID on our programs, but also will serve as cornerstone interventions in the sustained epidemic control era. As we move into the next implementation cycle, and particularly with more specifically the vaccine deployment, there will be guidance to the field to further support leveraging of our PEPFAR resources to support the COVID response. Many of you are aware that this year, the State Department released a cable that provided flexibilities in how PEPFAR funds could be used to support the COVID response. There will be a joint webinar to our USAID field staff in the next month or so, a joint webinar between USAID, CDC, and state to further provide guidance to the field that ultimately will guide coordination and communication to you all around how PEPFAR resources can be utilized in the COVID response. But really, we're already seeing this in both our international and our local awards. In terms of additional resources, there are not expected additional PEPFAR resources to support this work. $250 million in additional funding were previously released this year from state to support this work. We remain to see what additional funding will come through non-PEPFAR channels. But as of now, we're really looking to what can we do to optimize the resources at hand to support the response and do what we can, particularly around the vaccine deployment. Shannon, James, I don't know if you have additional points, but hopefully that answers your question.
Okay, great. Thank you, Clint. We're coming down to the end of our time here, so we're going to maybe try and squeeze in a few more quick questions. Here's a question: what is the acceptable level of USAID involvement in recruitment by local partners? So I don't know, Segun, if you would like to come off of mute and briefly provide a little bit more clarity, or if we feel that's sufficient and our speakers would like to respond.
Yeah, thank you very much. Basically, to know what level of involvement do you have with USAID? Is it at the top management staff of the local partner, mid-level, or the lower level, or no? But at no level at all is USAID involved in the recruitment or in having a say in the recruitment of the local partners, the staff that work there. I know that we do a search to be sure that they're not involved in any terrorism and all that. That one is given, but then whatever level of acceptable level of involvement is allowed. Over.
Hi, Lindsay, this is Luis. So recruitment of local partners as in organizations, or recruitment of local staff that we want to manage the activity? Which is it?
The staff that manage the activity. Over.
Right.
Luis, I think this might be a question about key personnel.
Okay, got it. So Segun, thank you. So we're really talking about key personnel, right? We're talking about the staff under the contract or associated with the cooperative agreement that you're managing. Specifically regarding recruitment efforts, there should be no involvement in the recruitment efforts. Okay. Now, when it comes to you undertaking the recruitment efforts, you want to identify certain individuals that you want to propose for key activities or key positions as identified directly under your award, and you put that forward to the mission, then at that point, we do control that. We directly control that decision. Okay, hope that helps.
Yes, thanks.
Okay, I think we have time for one last question that came through on fixed amount awards. Fixed amount awards are great. It ensures good performance and risks associated with that. Can USAID take minimal risk by providing advance funding for the first 3 or 4 months to kickstart implementation each fiscal year and be deducted in the milestone amounts during the year? So this will have to be our last question because we're running out of time. So FAAs, I'll turn it back over, I believe, to our OHA colleagues for this response.
Jonathan, can you take that one, or am I going to jump in?
Well, I'm happy to make a quick comment, but this also relates to payment advances, or CFO colleagues, I think, could also weigh in. I mean, normally with fixed amount awards, they're structured in such a way that the payment is upon completion of a milestone. So the way the question is phrased, it would be challenging to offer advances. I mean, there are separate procedures for actually approving payment advances, but it could come down to structuring milestones in such a way that organizations have the funding that they need when they need it, so that maybe there are shorter or more iterative milestones at the beginning of the year, so an organization doesn't have to wait so long to receive a payment. So if the structure of the payments can be worked out with the mission, keeping in mind that the organization might need some funding on hand, but it has to be based on some sort of deliverable. I think that's the key when it comes to a milestone payment. So that's something to think about. Thanks.
I'll just add to that, if I may, Lindsay. So this is just going back to the structure of the deliverable. And so don't be afraid to have these conversations directly with your mission, right? We know that we need to make sure that you have enough liquidity to implement the program. And so one of the ways of doing that is obtaining a payment upon the signature, upon the issuance of the FAA. That is possible. You need to have that discussion with your agreement officer because that becomes one of those deliverables, or establishing a mini work plan or something along those lines, again, to ensure that you've got enough liquidity and that you're thinking ahead. How often do you need payments so that you're positioned to support the activities? And is the work that you're undertaking going to get you there? Because you're going to have certain deliverables, certain milestones to achieve. So you need to make sure that you've got that in mind. Cash needs, cash flow, and then your deliverable. Back to you, Lindsay.
Great. Thank you very, very much, Luis and Jonathan and all of our speakers. We are at time, so I know there's several questions that we haven't been able to respond to, so we'll do the best that we can to try and get responses. But thank you very much to everyone who submitted your questions in advance and who engaged so proactively in the chat and on audio today. Thank you again to everybody. And we look forward to everybody enjoying the rest of the meeting. Big thanks to our speakers. Have a great rest of your day. Take care.